We are the students of Little Youth College of Nursing, Kidangur. As a part of Sickle Cell Day, we, the third year BSc Nursing students, along with the Child Health Department, are presenting a presentation on sickle cell disease. We felt that there is a need to be aware of the sickle cell disease in today's society. First of all, we are thanking our principal, Dr. Sister Josina SVM, for giving this opportunity. So let's move to the topic in detail. Sickle cell disease is an inherited blood disorder that causes sickle-shaped red blood cells that can stick together, blocking the blood flow and oxygen from reaching all parts of the body. Shine the Light on Sickle Cell is a national initiative to bring attention to this disease and to observe the World Sickle Cell Awareness Day on June 19, 2022. And the month September is observed as Sickle Cell Awareness Month. The first documented case of sickle cell anemia was published in 1910 by a physician named James Herrick. The first Sickle Cell Day was celebrated on June 19, 2009. The motive of commemorating this day is to promote knowledge about sickle cell disease among the general public. Burgundy has been selected as a representative color to help shed light on sickle cell disease.
So definition. Sickle cell anemia is one of a group of disease collectively termed hemoglobinopathies in which normal adult HBV is partially or completely replaced by abnormal sickle hemoglobin. Sickle cell hemoglobinopathy is a group of hereditary disorder in which red cells contain an abnormal hemoglobin HbS. Types: SCD, homozygous form of disease in which valine, an amino acid, is substituted for glutamic acid at the 6th position of the beta chain. Sickle cell C disease, heterozygous variant of SCD including both HbS and HbC. Lysine is substituted for glutamic acid at the 6th position of the beta chain. Sickle cell hemoglobin E disease, a variant of SCD in which glutamic acid has been substituted for lysine in the 26th position of the beta chain. Sickle thalassemia disease, a combination of sickle cell trait and beta thalassemia trait. In the beta plus form, some normal HbA can be produced. In the beta 0 form, there is no ability to produce HbA.
Next, we can move on to the pathophysiology of sickle cell disease. So due to the sickle cell trait, there is a defect in the beta chain of hemoglobin substitution of a simple amino acid. So HbS becomes sickle shaped when deoxygenated, which will cause a sluggish blood flow obstruction of blood flow microcirculation, which will be resulting in the sickle cell anemia. As a result, pain in any part of the body, organ damage, hemolysis and hyperbilirubinemia occurs. As the cells sickle, the blood becomes more viscous because the sickle cell clump together and prevent the normal blood flow to the tissue of that area. The sickle-shaped RBCs can't pass through the smaller capillaries and venues of the circulatory system. This vaso-occlusive process leads to local tissue hypoxia followed by ischemia and may result in infection and pain. Can occur in any part of the body but is most common in the joints. Pain causes increased metabolic need by resulting in tachycardia and sometimes tachypnea, which leads to further sickling. Clumping of cells in the lungs results in decreased gas exchange producing hypoxia. Sequestration of blood in the spleen leads to splenomegaly and abdominal pain. The increased activity of the spleen related to RBC hemolysis leads to splenomegaly, then fibrosis and atrophy.
Clinical manifestations. In general, possible growth retardation, chronic anemia where hemoglobin level of 6 to 9 gram per deciliter. Possible delayed sexual maturation, marked susceptibility to sepsis. And in vaso-occlusive crisis, in extremities, painful swelling of hands and feet, painful joints. In abdomen, severe pain resembling acute surgical condition. Cerebrum, stroke and visual disturbance. In chest, symptoms resembling pneumonia, protracted episodes of pulmonary disease. Liver, obstructive jaundice and hepatic coma. In kidney, hematuria. Genitalia, priapism. And in sequestration crisis, pooling of large amount of blood, hepatomegaly, splenomegaly and circulatory collapse. In effects of chronic vaso-occlusive phenomena, in heart, cardiomegaly and systolic murmurs, and in lungs, altered pulmonary function, susceptibility to infections and pulmonary insufficiency. In kidney, inability to concentrate urine, enuresis, progressive renal failure. In liver, hepatomegaly, cirrhosis, intrahepatic cholestasis. Spleen, splenomegaly, susceptibility to infection, functional reduction in splenic activity progressing to autosplenectomy. In eyes, intraocular abnormalities with visual disturbance, sometimes progressive retinal detachment and blindness. In extremities, avascular necrosis of hip or shoulder, skeletal deformities, especially lordosis and kyphosis, chronic leg ulcers, susceptibility, osteomyelitis. In CNS, hemiparesis and seizures.
Now let's move to the diagnostic studies. First one is history collection, then physical examination. Routine hematological tests are done to evaluate the anemia, sickle turbidity test, and hemoglobin electrophoresis.
In management, therapeutic management, the aims are to prevent the sickling phenomena, to treat the medical emergencies of sickle cell crisis, administration of pneumococcal and meningococcal vaccines. Child with SCD should receive a yearly influenza vaccination and oral penicillin prophylaxis. Short-term oxygen therapy if child has respiratory difficulty. In children with recurrent life-threatening splenic sequestration, splenectomy is recommended. Packed RBC transfusions for splenic sequestration. For mild to moderate pain, ibuprofen or acetaminophen is used initially. If these are not effective, codeine can be given. Hematopoietic stem cell transplantation offers the only cure for some children. Antibiotics to treat any existing infections. Adequate rest should be provided to minimize energy expenditure and oxygen use. Exchange transfusion is performed as it reduces the number of circulating sickle cells and slows down the vicious circle of hypoxia and thrombosis injury.
So we have come to the conclusion of our presentation. Hope those who had heard this get an idea about the sickle cell disease. Thank you.